Hello, my name is Dr. Matt Rowe. I'm a periodontist, board certified in periodontics and implant placement. My practice is in Columbia, South Carolina, and I'm a user of CO2 laser technology, in particular the LightScalpel. And I've done a lot of research as far as making a decision before I decided on a final laser to use in my practice. I've used a diode laser many times before, especially on infant frenectomy procedures, and was just not seeing the results that I was needing to see. I was seeing more inflammation, more swelling, more pain, potentially more reattachment in those types of procedures, and I was looking for something that was going to be much more patient-friendly. I was looking for a practice builder, and I was also looking for a company that would be able to explain to me the basics of how do you use the technology behind the laser, what does it actually do. And I researched all of the different laser companies that are in the United States. I personally called all of the CEOs of those companies, and basically I just got car salesmen. And they could not really explain to me the physics behind how that laser interacts with the actual tissues that I was needing to treat. And it didn't really bode confidence in marrying up with that company and with the laser that they were trying to sell. And eventually I had called Peter Vittruk, Dr. Vittruk of LightScalpel, and he was actually able to sit down with me and not only explain to me how his CO2 laser worked, but also the different lasers of all of his competitors. And when I was able to see the benefits and the drawbacks that he showed in each type of laser, it really was a no-brainer as far as what laser I was needing for the specifics of what I had to do in my own practice, which was treating periodontal disease, treating implants that were failing, and mostly what I do in my practice is doing frenectomies on infants and even toddlers and adults. And for that particular reason, it was just the perfect laser to use. It's a practice builder. There's very minimal to no bleeding with it. There's very minimal post-operative pain or swelling, predictive results. And when patients see this, they see the wound healing behind it. They comment that it was, very easy procedure to get through. They start talking to other patients that they know or other family members that they know, and I get a lot of referrals in my practice because of that. Yeah, it's just been an instrument in my practice that is a daily use for me, and it's a staple that I really can't live without at this point in time.